Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery respiratory system part 2. In the current session we will be discussing about accessory sinuses and the CPT range is 31000 to 31299. Coming to accessory sinuses, they are again divided into incision, excision, endoscopy and other procedures. The CPT range for incision is 31000 to 31090 and for excision it is 31200 to 31230 and for endoscopy the CPT range is 31231 to 31298 and finally other procedures there is only one CPT 31299. Coming to incision, the first CPT is 31000. Lavage by canaliculation maxillary sinus, antrum puncture or natural ostium. And to report a bilateral procedure, use 31000 with modifier 50. The next CPT is 31002. It deals with lavage by canaliculation sphenoid sinus. The next thing is 31020. Sinusotomy maxillary, anthrotomy intranasal. And to report a bilateral procedure, use 31020 with 50 modifier. The next is 31030, sinusotomy radical, Caldwell look, like Caldwell look type, without removal of antroconal polyps. And to report a bilateral procedure, use 31030 with modifier 50. The next CPT is 31032. Sinusotomy radical with removal. Previously it is without, now it is with removal of antroconal polyps. And to report a bilateral procedure, use 31032 with modifier 50. The next CPT is 31040. It deals with petricomaxillary fossa surgery, any approach. And for transantral ligation of internal maxillary artery, use 30920. The next CPT is 31050. Sinusotomy sphenoid with or without biopsy. The next is 31051. Sinusotomy sphenoid with mucosal stripping or removal of polyps. Whenever sinusotomy sphenoid is done with removal of polyps, the CPT is 31051. The next CPT is 31070. Sinusotomy frontal, external simple. And for frontal intranasal sinusotomy, use 31276. The next CPT is 31075. Sinusotomy frontal, transorbital, unilateral. For mucosal or osteoma, Lynch type. The next is 31080. Sinusotomy frontal, obliterative, without osteoplastic flap, brow incision. It includes the ablation. The next is 31081. It deals with sinusotomy frontal, obliterative, without osteoplastic flap, coronal incision. Previously it is brow incision. Now it is coronal incision. This also includes ablation. The next CPT is 31084. It deals with sinusotomy frontal, obliterative, with osteoplastic flap. Previous two CPTs are without osteoplastic flap. Now it is with osteoplastic flap, brow incision. The next is obliterative, 31085. It deals with obliterative with osteoplastic flap, coronal incision. Next is 31086. It deals with non-obliterative with osteoplastic flap, brow incision. And 31087 deals with non-obliterative with osteoplastic flap, coronal incision. And finally, 31090 deals with sinusotomy unilateral, 3 or more parasinal sinuses. For example, frontal, maxillary, ethmoid and sphenoid. Now let us see an example. Patient presents for frontal sinusotomy, non-obliterative with osteoplastic flap, brow incision. So here the CPT is 31086, sinusotomy frontal non-obliterative with osteoplastic flap bro incision. The next CPT is 31200. It deals with ethmoidectomy intranasal anterior. The next one is 31201, ethmoidectomy intranasal total. And next CPT is 31205, ethmoidectomy extranasal total. And finally 31225, it deals with maxillectomy without orbital exenteration. The next one is 31230, it deals with maxillectomy with orbital exenteration en bloc. And for orbital exenteration only, you need to refer the sequence 65110. And for skin grafts, you need to see 15120. Now coming to endoscopy. A surgical sinus endoscopy includes sinusotomy. This is an important point. A surgical sinus endoscopy includes sinusotomy when appropriate and diagnostic endoscopy. The codes 31295 to 31298 describe dilation of sinus ostia by displacement of tissue, any method, and include the fluoroscopy if performed. Stereotactic computer-based assisted navigation may be used to facilitate the performance of endoscopic sinus surgery and may be reported with 61782 whenever it is used. And codes 312332, 31298 are used to report unilateral procedures unless otherwise specified. They are mainly used to report unilateral procedures unless they are specified. And the codes 315231, 312312, 31235 for diagnostic evaluation refer to employing the nasal or sinus endoscope to inspect the interior of the nasal cavity and the middle and superior meatus, turbinates and the sphenoethmoid recess. Anytime a diagnostic evaluation is performed, all these areas would be inspected and a separate code is not reported for each area. That is also important. Anytime a diagnostic evaluation is performed, all these areas would be inspected. And you need not code separately for each area. And to report these services when all the elements are not fully examined. For example, judged not clinically pertinent or because the clinical situation precludes such exam. For example, technically unable, altered anatomy, etc. In that case, you need to append 52 modifier if repeated examination is not planned, or modifier 53 if repeated examination is planned. Whenever these services are not fully examined, all the elements are not fully examined, in such case you need to append 52 modifier. If repeated examination is not planned, it indicates reduced services, and if repeated examination is planned, then you need to append 53 modifier. Now coming to the first CPT, that is 31231. It deals with nasal endoscopy diagnostic, unilateral or bilateral. The next CPT is 31233, nasal or sinus endoscopy diagnostic with maxillary sinusoscopy via inferior meatus or canine fossa puncture, and do not report 31233 in conjunction with 31256, 31267, 31295 when performed on the ipsilateral side. The next CPT is 31235. It deals with nasal or sinus endoscopy diagnostic with sphenoid sinusoscopy, that is via the puncture of sphenoidal face or cannulation of ostium. And do not report 31235 in conjunction with 31257, 59, 31287, 31288, 31297 and 31298 when performed on the ipsilateral side. and to report endoscopic placement. To report endoscopic placement of a drug-eluting implant in the ethmoid sinus without any other nasal sinuses. Endoscopic surgical services use 31299. And to report endoscopic placement of drug-eluting implant in the ethmoid sinus in conjunction with biopsy, polypectomy or debridement. In such case, you need to report 31237. The next exhibit is 31237. It deals with nasal or sinus endoscopy, surgical with biopsy, polypectomy or debridement. The next is 31238. It deals with nasal or sinus endoscopy, surgical with biopsy, polypectomy or debridement with the control of nasal hemorrhage. The next exhibit is 31239. It deals with nasal or sinus endoscopy, surgical with dacriocystorhinostomy. The next is 31240. It deals with sinus endoscopy, surgical with concha bullosa resection. And 31241 deals with ligation of spinopalatine artery. And do not report 21241 in conjunction with 31238 when performed on the ipsilateral side. The next exhibit is 31254. It deals with nasal or sinus endoscopy, surgical with ethmoidectomy, partial anterior. And do not report 31254 in conjunction with the following CPTs whenever the procedure is performed on ipsilateral side. The next is 31255. It deals with nasal endoscopy, surgical with ethmoidectomy, total, both anterior and posterior. The next CPT is 31253. This also deals with nasal or sinus endoscopy, surgical with ethmoidectomy, total, including frontal sinus exploration with removal of tissue from frontal sinus when performed. And do not report 31253 in conjunction with the below listed CPTs whenever they are performed on the ipsilateral side. The next CPT is 31257. It deals with nasal or sinus endoscopy, surgical with ethmoidectomy, total, including sphenoidotomy. The next is 31259. It deals with nasal or sinus endoscopy, surgical with ethmoidectomy, total, including sphenoidotomy with removal of tissue from the sphenoid sinus. The next is 31256. It deals with nasal or sinus endoscopy, surgical with maxillary antrostomy. And do not report 31256 in conjunction with 31233, 37, 267, 295 when performed on the ipsilateral side. The next is 31267. It deals with nasal or sinus endoscopy, surgical with maxillary antrostomy with removal of tissue from the maxillary sinus. The next is 31276. It deals with nasal or sinus endoscopy, surgical with frontal sinus exploration, including removal of tissue from frontal sinus when performed. The next is 31287. It deals with nasal or sinus endoscopy, surgical with sphenoidotomy. The next is 31288. Nasal or sinus endoscopy, surgical with sphenoidotomy with removal of tissue from the sphenoid sinus. The next CPT is 31290. It deals with nasal or sinus endoscopy, surgical with repair of cerebrospinal fluid leak, ethmoid region. And do not report 21290 in conjunction with all the listed CPTs whenever they are performed on the ipsilateral side. The next is 31291. It deals with nasal or sinus endoscopy, surgical with repair of cerebrospinal fluid leak, sphenoid region. The next CPT is 31292. Nasal or sinus endoscopy, surgical with orbital decompression, medial or inferior wall. Next is 31293. Nasal or sinus endoscopy, surgical with orbital decompression, medial and inferior wall. Previously it is or, now it is and. The next is 31294. It deals with nasal or sinus endoscopy, surgical with optic nerve decompression. The next is 31295. It deals with nasal or sinus endoscopy, surgical with dilation, maxillary sinus ostium, transnasal or via canine fossa. And do not report 31295 in conjunction with 31233, 31256, 31267 when performed on the ipsilateral side. The next CPT is 31296. It deals with nasal or sinus endoscopy, surgical with dilation, frontal sinus ostium. Previously it is maxillary sinus ostium, now it is frontal sinus ostium. Next CPT is 31297. It deals with sphenoid sinus ostium. 31297. It mainly deals with nasal or sinus endoscopy, surgical with dilation. Example, balloon dilation, sphenoid sinus ostium. The next is 31298. It deals with both sphenoid and frontal sinus ostium. Now finally coming to other procedures. You have only one CPT here, 31299, unlisted procedure, axillary sinuses. And for hypophysectomy, transantral or transeptal approach, you need to use 61548. And for transcranial hypophysectomy, the CPT is 61546. Now let us see an example. A patient is seen in endoscopy suite for diagnostic maxillary sinusotomy. During the sinusotomy, the physician observes some diseased tissue which needs to be removed. And the physician decides to perform a maxillary anthrostomy with tissue removal. And bleeding is controlled. So here though the patient presents for diagnostic endoscopy, the physician removes some of the diseased tissue. So here nasal or sinus endoscopy surgical is performed with the maxillary anthrostomy with the removal of tissue from maxillary sinus. So the appropriate CPT is 31267. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.